There are some faces. Can you guys hear me? Yeah? Okay. And I've got you guys on mute for right now, but whenever we start chatting, um if you have something to say, unmute yourself for that time to speak and then mute yourself again so we don't have a whole lot of background noise and interference noise. Um, I'm gonna pull up a couple of slides to help us stay organized. Let's see. All right, so today, I don't have a whole lot on our agenda, but we will be um, doing quite a bit of discussion today. Um, I want us to go around and to check in with each one of you so that you can share with us what you have been working on since last week, any kind of challenges that you've encountered, and just kind of an overview of what you've learned about the topic that you were sent out to explore more about. So we ended last week kind of talking about mental health and substance use issues with mental health professionals that are on the front lines in um, taking care of COVID patients. And so we left off with you guys thinking about reaching out to a social worker who works at a hospital or who is on the ground to get their ideas about the problem and what they're seeing in their daily practice. So I'm going to leave this slide up while we go around and do check-ins so you can see the questions that I want you guys to think about and answer. So, what have you done since last week? What have you learned about the issue since last week? And if you have new questions or ideas about what you think our next step should be, or what we need to find out more information about, or if you have ideas about the intervention, kind of the next step. All right, who wants to get us started? Caitlin, do you mind being our first person? Since Caitlin had sent me an email um, that she has a meeting actually today with a social worker in her area, but I'll let her explain. But she reached out to me with some information, so I'll let her go first.
Okay, what I did was I did the mental health and substance abuse and started looking at a couple of the major healthcare systems in my area, but I also expanded it to behavioral health and detox centers. And there is a social worker at one of the healthcare systems here in Omaha who is very interested in the project. He's kind of interested, with we're looking at it from a mental health standpoint, but also he's thinking, can he tie it into healthcare? And I explained to him we were looking at gaps in services, how has mental health been affected, things like that. He said with their mental health, because they provide about 80% behavioral health in all of Omaha, their mental health appointments have actually gone up they've had less no shows, less drop offs because they've had to go to HIPAA compliant Zoom, I think was what he said. So he said there's that, but also, maybe consider checking with one of the rehab centers, see how they're affected. So I'm talking with a drug and abuse counselor at 2 today. But then when I was also looking some more, I found out that there is a homeless shelter, but it's also it's a treatment center slash homeless shelter slash permanent supportive housing. They have had an outbreak of COVID, and their entire facility has had to quarantine and go into lockdown. And that's one of the biggest homeless shelters in Omaha. And they're like, we can't take anyone. You have to either go somewhere else or stay on the street. So, I mean, this isn't just limited to healthcare, it's far more reaching than that. And so I'm kind of interested in exploring that too.
Yeah, that is. That's something that I've been particularly interested in is the homeless shelters and the prison population, that there are several outbreaks that have been reported, and with it being such close quarters, um, it makes it an even more pressing kind of issue. And for the homeless shelter, also, it gets tricky because people are in and out of the community. And so, without a lot of testing and tracking, um, you don't know if people are on the streets or also spreading COVID too. So, if that's something that you guys, as we go along, is something that we're interested in, I know of one social worker here locally in Lafayette, Louisiana, who has been working with their local system to get hotel rooms for people who are experiencing homelessness, and that's been their response to things. So I could have her come and talk to us maybe next week. She can come and talk to us for a few minutes if that's something that you guys are interested in, or something that we're interested in exploring um, for our project, because there are different responses that different areas have done for COVID, specifically surrounding people who are homeless. Thanks for sharing that, Caitlin. So, and it also sounds like in your conversations that there was more that came up about how the system is breaking in certain parts, or where there are needs in general. As a group, we had kind of thought that that might be stress on the workers themselves, but it sounds like what you found so far in your community is that there is an increase in need for behavioral health services that isn't they're not able to meet right now, like there's too much need.
There's too much there's too much need. Not everyone's able to meet, and there's not enough social workers. The social workers are going from healthcare system to healthcare system, and they're going all over the region, which in my area is they're going from eastern Nebraska to northern Nebraska. So that's 6 counties to cover.
Mm-hmm. Yeah.
There's not enough resources.
Mm-hmm. Okay. All right. Who wants to share next? Joanna, I see you next on my little squares. Are you ready to go?
Sure, I am. So I'm in a bit of a different situation with our community here because I live on a military installation. So it's key essential. So things haven't stopped going outside of our installation. As far as behavioral health here, nothing, she said nothing really has changed. Everything's been going on the same. So I reached out to a friend of mine who is a social worker on a National Guard facility installation in Tennessee.
Mm-hmm.
And she told me that there's been a spike in domestic violence, um, chaplain visits, and she said a lot of that coexists with substance abuse already. So that's what they're seeing there.
Mm-hmm. Okay.
Um,
So even though it's not labeled as mental health or substance abuse, they're seeing this in a spike of domestic violence cases and visits,
yes,
right?
yes. And I guess because everybody's home
Hmm. Right.
there. So, yes, that's what
Yeah.
she said.
Yeah, I just want
I
to
know nationwide we've also seen rates of child abuse go up too.
yeah.
Mhm.
I was just
Um,
gonna say, like to what she said, like, I know like here in Arkansas, that's like a big concern right now, child abuse and domestic violence, because currently a lot of like women that are going through domestic violence, they don't have the access right now to, because everyone's supposed to be at home, so that's a big concern here right now is the people who aren't able to actually report the domestic violence that's going on.
Hmm.
I agree with them as well. I agree with them as well. As of right now, I'm also dealing with my agency is actually closing or they're selling because of them not having to be able to have clients inside. They're losing their funds on everything. So they're closing completely. And that's why I'm remotely doing my internship online. So
Hmm.
they're losing business. Their clients are needing them to be there because I was working with older people. They had medication as well before their various different of health reasons. So they're not having access to actually have somewhere to go, an outlet for their stress or anxiety or depression. So it's a lot of abuse or child abuse and loss of jobs and everything that's going on here in Monroe, Louisiana.
Hmm. So what type of agency were you working with, Alexis?
It was a patient facility where people actually they were commuted to us at Cypress Grove Behavioral Health Center.
Okay.
They
Yeah.
actually commuted to us. We had a transit that would go pick them up and bring them there every day of the week, or how many every days they were prescribed to come.
So was it more of an intensive outpatient program or
Yes, ma'am. We had group therapy.
mm-hmm. Okay.
It was more of an intensive, yeah, for sure. We had 3 different groups, depending on their level of stress or whatever it was that they had, and we also fed them lunch. They stayed there like 4 to 5 hours during the day. We did activities with them. Went over a bunch of group projects. We fed them breakfast and lunch, and also did games or whatever we could just to fulfill their time.
Mm-hmm. Okay. Great. Uh,
Um,
Anthony, you want to go next?
sure. So I had a little, I guess, a different experience. I'm out here in California, in Los Angeles, and I actually reached out to a member of my old agency because they let the interns go once the whole lockdown happened. But I reached out to her, and it was an inpatient detox center and treatment center,
Mm-hmm.
and well, it was both, but what she said was that they stopped outpatient altogether. So they're only doing inpatient, and what she had stated was that they have their highest numbers that they've had in a very long time, because what she said was a lot of the homeless population out here in Los Angeles is insane. It's incredible. So what she said was that a lot of the addicts will come in because they're homeless and they just right now in this time they need a place to be, and they don't think it's safe to stay on the streets, so they'll find their way and they'll come into the detox center because this way it gives them a place to stay, and then they'll also be detoxed. So yeah, and she said that they're similar to what a few people have said, where they're just, because there's no interns, they're lacking a lot of social workers. They just need more, because they haven't really never gotten to a point where the patients have, like, the ratio between patients and social workers has never been that distant. So now they're really struggling with finding social workers. So yeah.
Mm-hmm. Yeah, and in that situation, it's for social workers to actually come in too if they're doing all inpatient services. So I can see where that would be difficult with some people wanting to distance themselves
Yeah.
personally and not wanting to go into a hospital
Mhm.
if they didn't have to. Um,
Yeah.
yeah, so that is interesting to think about how this is different in your different areas too, because
Mhm.
we are spread geographically all over the country. When they were putting this together, I made a comment in one of our planning meetings. I was like, "Oh, well, what about the students who are in other states?" And I guess they took that as I want all of the students who are all across the country, which I think is it gives us a creative challenge here because for
Definitely.
us to come together, I think that we're gonna have to either pick one of your locations for us to all kind of specialize and focus on, or it's gonna have to be a project that is something digital, so using social media or being able to offer some sort of services through the internet. That's kind of what's been going on. The gears in my brain that have been going is okay, if we don't have enough social workers, there are services that can be provided on the internet by professionals and paraprofessionals. My background is actually in crisis intervention, and so um, I've worked in crisis intervention and then also in developmental disabilities. And so when I worked for a crisis intervention center, we did all of our counseling over the phone and over the internet. So it
Mhm.
was all suicide intervention and prevention mainly. And then we had some contracts being in Louisiana that were specific to different disasters. So when Hurricane Katrina happened, we had a specific contract to answer calls. And that was a really crazy time because their 911 calls were actually coming to our phone line. So we were answering like the 911 calls from people who were on a roof and, looking for help. And, so that's some of my background. So when I hear you guys talking about this, I think that there could be a solution with us being geographically dispersed. But something that we have to think about with any kind of digital services is what is social work considered in your state. So doing a little bit of research that this would help you guys too as you finish your program to know what are the licensing laws in your state, what are the laws about telehealth in your state for social workers, have they been loosened at all because of COVID-19? In Louisiana, they have been. So things that they used to say, oh, social workers can't do that, we can now. So for a long time, they didn't want us to do telephone counseling, and now they have waived that so that we can do some telephone counseling. It used to be where you had to do it face to face to deliver it. Um, but at the same time, if it's crisis intervention services, then we could say that it's not professional social work services, that it's some sort of paraprofessional service. And I've trained social workers on doing suicide prevention and crisis intervention in this kind of capacity online, mainly through text, though. So through chat rooms and text messaging. So the video format is something that's new for me. I have seen clients in a non-crisis setting, just in a general individual therapy setting in this way, like a face-to-face video chat. Let's keep going through. I'm interested to see what the rest of you guys have found have who hasn't had a chance to talk yet. Amy or yeah.
Yeah. I talked to a social worker at my agency, and she said a couple things. One is that, like, the issue of co-occurring disorders, like one of the issues she mentioned was that there aren't enough people trained in both. You either have people who are trained in substance abuse treatment or mental health treatment, but not like when you have someone who struggles with alcoholism and also has bipolar disorder. So that issue was run into on a like kind of provider training level. And then also a lot of the cases that she talked about getting were based on like drug court referrals, which
Hmm.
is great and needed. But she said we also have a hard time accessing people who are struggling with addiction but don't initiate treatment for whatever reason. So kind of doing more outreach on that level.
Right. I imagine that there's probably some point of intervention from what we were talking about earlier with domestic violence calls, that there's probably some overlap there um, for intervention. So who else do we have? So that was Lily, right?
Yeah.
Okay, and then Amy.
Yeah, I can go.
Okay.
Um, I really liked your idea of what you were saying about doing some sort of crisis intervention. I just wanted to mention that before I forget. I just moved to this area. I live in Biloxi, Mississippi now, but I really don't have any established contacts here. I don't know a whole lot about the service system here. I reached out to a friend of mine who's a social worker in Bentonville, Arkansas, and she works at a drug court. And I was just asking her what it was like with this all going on. And she said that um, she feels like a lot of their clients right now are just kind of hiding what's going on because everything is virtual. And a lot of people are just kind of making it work. But once this gets further along, that there's going to be, with all of the economic impact, there's going to be a lot more than what they can handle. And I also wanted to mention that I read this article that was really interesting, and it really touched on what Caitlin started with. It was called Collision of Public Health Crisis, COVID-19 and Substance Use Disorders. And just talked about how our system can't handle what's about to happen. There's just not enough social workers. And a lot of people are suffering because of the lack of contact, the lack of social support. And so there's going to be, an increase in the opioid fatalities. People just can't get in to get services like they normally would. They don't have their supports in place.
Right. So, another thing that I'm thinking about is Lily has posted, if you could send that article, if you can send it to me, Amy, I'll send it out to everybody because I'd
Sure.
like to take a look at it too.
Sure.
Anytime you guys find something like that, I'm happy to share it with y'all. Since we don't have a course Moodle page, that's why navigating technology this summer has been a little difficult for me because I'm not sure what the best way for us to communicate is going to be. That's why I've kind of patched together, using the community Moodle and maybe using Remind or the Padlet that I sent out to you guys. But we'll eventually kind of get into a groove with what works best for us. Even if that means like having like a WhatsApp group or something like that. I'm open to exploring whatever option works best for you guys. I'm sure y'all probably know a lot more about that kind of stuff than I do. Um, so if you have ideas, let me know. I have a little bit of time today to show you guys what the Padlet thing is so that you can kind of understand it a little bit better. But I think that it'll be a good way for you to share your journals with me. On my end, uh, a thing that gets kind of complicated is what kind of information I ask you guys to share with everybody versus just with me, because of the personal nature sometimes of reflections and the fact that sometimes they're graded. I don't want you to have to show it to everybody, so it can just be between the two of us. But of course, there's going to be other things like this article that we might want to share with everybody. So if you have ideas, just shoot me an email or let me know. So another idea that I was thinking of with this is is about how do there's probably some level of services that could be provided to everyone that is more like um first aid, so not necessarily like the deep heavy therapeutic lifting kind of stuff, but the self-care kind of things, like how do you behavioral activation is a strategy for depression. Like how do we get people not to sit on their couch all day and to get up and get moving, maybe to have a check-in meeting like this, that what if we develop some sort of system like this where people, social workers could refer clients who maybe are waiting for services to come and pop in for like a psychoeducation group where they learn about how to use I statements, or how to have healthy exercise, or just set a goal for that day, like an accountability group of sorts. There's a lot of literature like across disorders and across problems for that type of work too. A good example is DBT, dialectical behavior therapy. I don't know if you guys have heard of that, but it's most of the research behind it is for borderline personality disorder, but it's also been adapted to lots of other different mental health issues and populations now. And a huge component of it is these skills and skills building. So a person who's in DBT will have individual therapy, but they also might meet with a group once a week where they work on DBT skills, like interpersonal skills and taking care of themselves. Um, so that's another thing that I'm kind of thinking in my head, that it would be something that would be good for you guys too, because those are like kind of the bread and butter skills for therapy, getting your feet wet of working with people in therapy. Across all different types of issues, you'll find that kind of psychoeducation work and that kind of self-care building. And, there's a lot of kind of underlying cognitive behavioral interventions with that too. So changing the way that you think about problems. Um, what do you guys think about that?
I think that's a great idea. I wasn't able to touch on who I spoke to yet, so maybe I
Oh
can
yeah,
on
yeah,
that.
share, yeah.
And it actually ties into what you're saying about self-care a little bit. So I am in Southern California, I'm in San Diego, and I spoke to a social worker in Northern California who works at a children's hospital. And the majority of the social workers that work at that hospital have been asked to stay home and work with their patients through Zoom or Skype. And kind of touching on what Amy said earlier, that loss of contact, like physical contact and being in the patient's room with them, has made it more difficult for parents, because at the children's hospital, the social worker really focuses on the parents and also the child. But so the social worker said it's creating more of a tense environment. And so if they can establish some sort of self-care packet or some way to train the parents of the patient to have healthy self-care, it can create a better environment for everybody. So I think that's a great idea.
Okay, yeah, that sounds like a really good idea. So when you're talking about self-care for the parents, do you mean like that the parents don't want to leave, or they're like staying there That's a common issue anytime at a children's hospital and like in the NICU to getting parents to take care of themselves.
Yeah. So when prior to the pandemic, self-care was a huge thing for social workers to kind of train the parents on. And now that the social workers aren't there at the hospital and they don't have access to the parents all the time, and the parents vice versa, the parents don't have access to the social worker, it's more difficult to determine how much the parents are actually caring for themselves. And there's also, with the pandemic now, the parent is even more concerned about the healthcare their child's receiving because they want to know that every nurse is washing their hands or wearing a mask, so they're more, I believe, more on top of the healthcare that their child's receiving.
Hmm.
So, yeah, I think self-care is so important, not only for the parents and the patients, but also for the social workers themselves.
Right, right, yeah. I've seen some interventions, and I don't know how well they have been received, but this might be a project for you guys to explore this week. Um, is there are some social work organizations that have opened up like a weekly hour, a lunch hour where it's a Zoom that's open to any social workers to come and just kind of talk and from anywhere. It's the one I'm thinking of is it's Management and Social Work. That's the organization that does it. But it might be interesting for you guys to go to it to see what it's about, or even if a few of you can just hop on to one of those calls to see what it's like, because that might be something that we could explore as an option for social workers for self-care, for us to maybe come up with some sort of curriculum of sorts, or at least like some what different sessions could be like whenever people hop on to this, um, to plan for later this summer. Um, and I know that students usually in this type of class and this type of community class get really nervous about the open-endedness of this and all of our kind of bouncing ideas around and not being 100% sure what we're going to do yet is all very normal for this kind of project. And um, it, it should be this way so that we really focus on the real need, because if we go into something and say, oh, we already know 100% what we need to do to fix this, let's do crisis intervention, we might miss the real problem. And so um, that's why it's important for us to kind of tread slowly, even though this is kind of an uncomfortable time, sitting with some of the ambiguity of what's the next step. It's important to make sure that we really assess really well so that we're designing an intervention that's going to be most impactful to people. Um, has anybody else not had a chance to share yet?
Yeah, I
Yeah,
haven't
okay,
I haven't
yeah.
shared yet. I was working at a sexual assault agency, and PS, their numbers are actually down, which is kind of ironic. But they work very closely with the domestic violence people. So I reached out to one of the social workers who works in a shelter, and they've been, it's been a very uh, big deal for them, and they've had to extend people's stay. Normally they try and turn people over much quicker, but they can't do that, and they can't get them out safely, and then they can't take in new people without a sort of quarantine before. So they've been using hotel rooms in the area to try and compensate for their numbers, but they've been, really busy. They also have a problem with their volunteers, because the volunteers, to answer the hotline, you're supposed to be in the shelter. And
Mhm.
so they've had to change their system around. And I think it's been very personally, I had worked with the social worker, so I knew her reasonably well professionally, but she and I also have children the same ages. So we talked about, how difficult it is to manage your own anxiety while you're dealing with, people in crisis. And so I know we're kind of all over the place, but I think crisis management, self-care, some sort of curriculum to support social workers supporting people would be a really useful thing.
Hmm. I agree too. Something I've kind of anecdotally experienced is I'm in a lot of groups on social media for people who are in private practice or who are social work educators, and that's been a theme that I've seen come up is whether it was an organized effort, hey, we need to take care of ourselves, or just something I've witnessed is people trying to do too much, how are we expected to be our kids' teachers right now, and still be working, and doing all the same work that we were doing before, just at home with our kids at home? That's been a big issue. Also, how do you handle the stress of having a partner that's essential worker who's going in to work every day and maybe exposing your family to COVID? So I definitely think there's some unique issues for social workers that I think that's definitely something that we could find some unity with across all of the geographic locations. Bria, have you been able to share yet?
No, I have not. So I actually interviewed two social workers. One was from an agency that I was just at before this happened. And then one is one I currently work with. She's dual diagnosis. She's an LCSW. And for both of them, they actually both touched more on the addiction piece. So the one that works in our clinic, she runs IOP, intensive outpatient for substance users. And we right now don't have that opportunity to do that through telehealth because of insurance purposes and other, I think, HIPAA as well. So probably about 60% of our clients have relapsed, from what she had said, and they are not following through with their sessions. So it kind of goes back to the self-care on, some of them just aren't, some of them wanted that face-to-face interaction. Now they're not getting it. So there's definitely been an increase. And then the other social worker from the agency, she said that she has been getting referrals from doctors due to addictions and relapse. So she said she's been making more referrals for substance dependency rather than like mental health is what she usually is making referrals for because she's in medical social work.
So, say a referral, do you mean like to a detox or to a dual diagnosis?
Yes. Yes.
Okay. Yeah.
Yep. So there's definitely been an increase. And then I'm in Wisconsin, and we have actually the increase of overdoses has been skyrocketed. I live in Sauk County in Wisconsin, and it's like every other day that someone's ODing. So, and I asked, and they said that there is an increase in Sauk County for overdoses.
And I'm just assuming, is this opioids or all types of overdoses?
Yep.
So something else that we could do at this stage to learn a little bit more about the issues is, and for you to get some more hours right now, is for you guys to do some additional training in this area. So one thing I'm thinking would be relevant for any of you guys, if you haven't already, is to do an Esprit training. Have any of you guys been trained in Esprit? Spirt? I can never remember what acronyms stand for, but Esprit has been like this big national push for quick assessment and brief intervention for substance abuse and for mental health issues. So it's been more of like a behavioral health push, but particularly thinking about that issue that a lot of people who have mental health issues may also have a substance use disorder and vice versa, and that up until this point in history, I guess we've tried to treat these two issues separately, and we're learning now that really there is a lot of overlap, and that the best way to approach this is in a collaborative way, and that we need cross training for people. So I can send you guys an email with, I think they have one of the Esprit trainings up on the LSU site, like for the field education. So there's some students who are supplementing their hours for internship like this, like we're doing now, the skills lab, and then additional trainings. And I think that they have one for Esperett up there. I can send you guys the link to it. It's probably, I think most of them are around 10 hours for the Esperett training. There's a lot of different universities who have gotten federal funding to do this. So I know that LSU was one of them too. So let me talk to my contact at LSU about it too, because she may be somebody who'd be willing to hop onto our call. And she's been my mentor, and she's in substance abuse, so she might be somebody to pick her brain too about this. But I think that it's a good use of your time is to do the Esperett training, because something I've heard more than once from you guys is that we need cross-trained people, and we need social workers who understand both of the issues there.
So I'm sorry. So you're going to be sending us that link through an email?
I'll
Okay.
send you an email after our chat today with the information about the training that I'll recommend for you guys. And even if, just a couple of you do it, that's fine. But I'll probably make recommendations like this for you in our calls. And if it's something that you think that is gonna help you and what you're looking for the knowledge that you're wanting to build, then you can take it or leave it, as long as you're getting your hours and things. So I'm not going to be looking that closely at your journals to be like, oh, I told them to do Esperett training, and look, Amy didn't do Esperett training, but she did some other fantastic training that's related to what she wants to learn. I'm not going to ding you for that. I really want you to be able to use the flexibility of an experience like this to get something that's really personalized. And so if you ever feel like you're running out of things to do, or you're not sure what the next step is, reach out to me. We can have a phone conversation. We can come up with ideas about what you should be using your time for. All right. Is there anybody else on here that I've missed? Anybody else? Dorica, I see that you're on. Do you want to introduce yourself?
Hi, yes, I'm my video's off because I'm at work right now. My name is Derrica Pruitt. I'm from Mobile. I'm in my first year, of course. And I was previously interning at a hospital before COVID. This is my first weekend. I had to catch up. I actually work in social work with child welfare, and a lot of people don't realize that we're kind of the unseen people in the midst of the pandemic. We're still working. So most of the things that we're needing is abilities, more resources to provide for our families that we're working with, and ideas of how we could, make this process a little more cohabitable for them, because that's our biggest thing, is that we're encountering a lot of angry people with us. But of course, we're not responsible for the pandemic, so we have to, remind them and try to do as much as we can to help them.
Mm-hmm. So it sounds like a lot of people, it's kind of handling those crisis skills, helping people to kind of manage their emotions during this heightened time. Unfortunately, social workers get the brunt end of that
Yes,
a lot of times. Even
of course.
if we had anything to do with the pandemic, we would make it stop, right? But
of course.
All right. So before I move into our next topic, is there anything else that you guys want to share right now?
I was just wondering what kind of resources, Derica, you feel like you need that you don't have. Is there anything in that area that we could help with?
Well, we have like certain the schools are providing lunches and stuff like that, but a lot of them are experiencing they're not able to get as many housing opportunities because they're a little hesitant with allowing them to move and things of that nature. So that's been kind of a holdup on our end. We're not really able to do visits with the families because of this. So that's kind of been putting a damper on a lot of the things. But we have some food resources, but of course, we could never have too many,
Right.
especially with the amount of people that we work with.
You kind of broke up there a little bit at the end. But it sounds like you're saying that they're missing that face-to-face interaction with people.
Yeah, we're not getting as many as uh, are
Okay,
used
I think we're
to, and
a little.
the
Is that my
families
phone?
are really
I don't think
dealing
it's
with
you,
it.
Alexa.
So
I
that
think
means
we're
a lot of people are visiting with their children.
yeah. Um. Okay, so what I'm gonna
Yeah, it could be my office.
okay. What I'm gonna do is I'm gonna move to our our next item. Can you guys still see the PowerPoint presentation too? Okay. So I'm moving to our Padlet. So Padlet is so the last two things that I want us to do today is for me to show you the Padlet website and what the functionalities are for the journals that I'm asking you guys to do. It's just kind of one sliver of what Padlet can do. So I'm going to show you that. And then the last thing that we'll do is from the things that we've talked about today, make a plan for what we're going to work on for our next step. And so that's going to mean, each time that we meet, getting more concrete on what our next step is. And I think that we have some good ideas, but first, let me show you what I want to show you for Padlet. Before I we started today, I tried to log on, and there's some sort of issue with my account, I think, with this, but I'm going to try to show you a student who ended up having to drop out of our group to show you hers. Do you see my email right now, or do you still see the, okay, I gotta press another button. Okay, do you see the new web browser? Okay, so this is kind of what yours should look like. And the format for this particular Padlet is in a stream format. So that means that anytime you post something, it'll just post to the top, and it's a lot like a blog. So whenever you add something, by clicking on this pink little button, then it'll post it to the top. Um, I also will be posting things to your Padlets. Like I have another Padlet like this where I'm writing my notes like this after each session, and I'm copying them to your board. So that's kind of a way for us to share notes about the meetings. I also can share the video from the meeting with you that way. So you may see some things populate on your link that you didn't write. That's from me, just so that you can keep all of your notes together. Whenever you do want to write something, you'll click on the pink button Can you guys see where I'm pointing to on here? So whenever you click on that, it pops up right here. And so you either can, you can, I may have a question.
I think I do. Did you send that link to the ML app? I could get it.
So you should have an email from me
Yeah, but it's online.
because they had their own.
I
Um,
text you. I found it somewhere.
for, for Sana, I think that you're not on mute. Can you mute your phone? Oh, I might be able to. There we go. Okay. Did you have a question?
I'm sorry, I muted myself back.
Okay. All right. There's
Can
just
you
some
hear me?
background noise. I can hear you, Alexis. Yeah. So,
Okay.
Alexis, from my answer to you was that each one of you is going to have a personalized link that I emailed to you. And so that's what you'll click on to get to your link. Whenever you go to add to it, you should just be able to click on that button and add, and it'll either add you as an anonymous person, or you can go up to the top and you can log in. And so you can sign up and have your own like password to log in, and it'll show up with your name like it does for me.
Okay, and you said you sent it to us through an email because I don't have it through the email.
Okay.
Just like today, I never received a link from you for the Zoom meeting.
I
I had to get from
you know what, Alexis? I think since you got added later, you're not on my list. I'll add you to my list. That's probably what the problem is. I'll send it to you after this meeting, okay?
Yes, ma'am. Thank you.
Okay, so does everybody see how to add the entry now? And really, you can add a lot of different things on here too. So, you can add a document, you can upload something, you can add a video, um, you can add a picture, and then if you click on this, there's lots of different things you could add. So if you wanted to add a video, there's a place for you to capture video, do a screenshot. There's really lots of neat things that you can do with it. I have you guys set up in the stream format, but there's also all other sorts of layouts that you can do. So in some classes, I have it set up for us to share resources like a bulletin board, or as a map. I've started using it as my map for some classes where people can drop pins of where they're located and we can see where people are located across the country. So there's really a lot of ways that we can use it, but to get started, I want us to use it for you to update your journals. And so for the journals, you should be doing at least one a week. And it's really just to kind of get your thoughts together about what you've done that week, kind of like what we did in the check-in verbally today. So what did you work on? What are new questions you have?
I have a question.
Yeah.
Is there a certain day that you want these by?
Yeah, so I'm going to be looking at them before we meet each Thursday. So if you can have them by Thursday at 8 a.m., that's whenever I'll be looking at them.
Okay.
All right. Any other questions about Padlet? No? Okay. All right. Let's move along to closing up for today and making sure that everybody has their marching orders or their next steps of what to work on. I'm going to stop the share. Okay, so we've talked about a lot of different ideas. What I'm kind of hearing from you guys is that it seems like you're all interested in social work health, so the actual health or well-beings of the social workers who are out in the field. That's kind of been a theme that's come up with what you guys have shared, and that the demand for services has grown larger than what social workers can currently support. So more people are looking for behavioral health services, looking for substance abuse services, and there aren't enough social workers out there to meet the need. And so I'm imagining that that contributes to this overload too, and this sense of stress for social workers, is feeling like we are needed, but how do we take care of ourselves and also address the need? Am I missing anything big, or is that kind of the overall message? Okay, so I want you guys to do the Esperit training. I'm going to send you the link for that to work on that. That'll probably be, your main goal for this week, is to do that training. And to also kind of think about how substance abuse fits into this, because we did think about social workers who may be drinking or using substances themselves. And how do we reach those people? And usually, traditionally, that doesn't come up unless there is some sort of issue with licensing. Like, there's some issue where it's impacted a social worker's ability to practice safely, and they've been reported by another social worker. And so how do we get, even before that ever happens, to address, drinking or drug use that's becoming problematic? So that's something I want you guys to think about while you're doing the training, is, what would that look like? How do we support social workers? And as a social worker ourselves, kind of some self-reflection on what that looks like, what we need for mental health wise, or what we need substance use wise, what might be helpful, and to continue these conversations with other social workers too, and other healthcare workers, to continue to kind of gather voices about this, so that, like I said before, we pick a really targeted intervention, and one that's going to help the most people, and not one that we don't have a lot of data to support. We want to make sure that whatever we choose and whatever we put our energy in is going to be something that we have a lot of buy-in from a lot of people about. Okay, so does everybody understand what they're going to be working on this week? Okay. And the other thing to kind of think about too, and you might write about this in your journals, or kind of start, if you're a nerd like me, kind of do a little bit of research, is what's out there, like, are there curriculums for self-care for social workers? I know the answer to these questions, but I want you guys go and look and see what's out there, what's what's been done out there. That's another thing for us to kind of talk about. All right. You have any questions for me? No? Okay. I am going to try to bring in a guest for us, maybe next week. If you guys have ideas of people that you would want to hear from, I can, I have access to a lot of people on faculty from various backgrounds. So if there's something that you want to learn more about, just let me know. I might actually see if maybe Miss Tracy Lilly will come and join us next week, because she, out of everyone in our program, has the most experience with licensing boards and with social workers, like in Louisiana at least. And now, since we have become such a big online program, everybody knows Miss Tracy. I mean, Tracy Lilly is a part of most social workers' education in the state of Louisiana. So she's a really good person to know. And she might have some ideas for us. All right. Well, I'm going to let you guys go. If you have questions that come up, just shoot me an email and we'll hold this time on our calendars to meet each week. Okay. All right. Bye.
Thank
All
you.
right. Thank you. I will be looking forward from the email.
I will. I'll send it in like